Good evening. Thank you so much for joining us on this episode of Your Health. My name is Purity Museo. The second trimester of your pregnancy lasts from the 13th week to the 28th week, or months 4, 5, and 6. It's the middle phase of pregnancy when you may start to see your baby bump and feel your baby move for the first time. What should a mom expect during the second trimester? Dr. Maureen Owiti is still here with us to share more insights. Welcome to this show, and once again, welcome to the program. I think we should just start from where we left last week. You know, we finished on the first trimester, and are there some of the complications that, if unchecked during the first trimester, could spill over to the second trimester?
Okay.
Yeah.
Thank you so much for having me, Purity. Let me start by saying that. And I hope the program will be educative to our viewers. Now, are there some complications if left unchecked can lead to further complications? We will normally, as I said, the first trimester, ultrasounds are our friends. And ultrasounds have become machines that are very useful in helping to diagnose several complications. Now, one of the most devastating complications of pregnancy is the high blood pressure of pregnancy, which has proteins, what we know known as preeclampsia. Preeclampsia is a specific entity whereby a woman has to be pregnant. It normally starts in the second, beyond the 20 weeks of gestation. And they develop high blood pressure, and along with that high blood pressure, in most cases, they will have some protein in the urine, and that is why you see when we're doing the normal tests during our antenatal visits, one of the most basic tests we'll do is we're going to check our blood pressure, and we're going to check the urine of the expectant mother. Now, ultrasound is able to give us information that's going to tell us that this woman, based on the flow of blood in her uterine vessels, that this woman is at high risk of developing preeclampsia later on in the pregnancy. And as such, we will now do some measures to try to reduce the probability of that preeclampsia coming, or actually delay the onset of the symptoms. And the simple thing is we're going to give junior aspirin. Junior aspirin, especially like for hypertensive patients, cardiac patients, they're very aware. It's a low dose aspirin. And that has been shown that it can prevent preeclampsia. Between the second trimester, we normally have done a lot of screening. So I've said simple things. We're going to check her blood pressure. We're going to check the weight. We're going to check her urine. We're also going to take blood samples, and the blood samples will be for very basic things. Things like her blood group, the hemoglobin levels, that's the blood levels, and to check for her HIV status and for any other sexually transmitted infections. The most common we check is syphilis. Not routine in the public health system to check for hepatitis, but that is one of the other things that we can also screen for.
Right.
If you feel like there are at-risk populations for things like the diabetes, we will normally also do a blood sugar, and also in the urine we can also see any changes that may lead us to suspect an issue of diabetes. There are some at-risk populations whereby thyroid problems can be an issue, and we'll also use this time to vaccinate. In this part of the world, the most common vaccine we give would be the tetanus vaccine, and that is what is being given. In other parts of the world, they're also recommending if we can give the flu vaccine. And elephant in the room, I believe entering the set, we're all in masks. We just have a beautiful social distance. I'm hoping you're vaccinated, Purity.
I am.
Thank you. I'm also vaccinated. And the vaccine we're talking about, obviously, is the COVID-19 vaccine. Currently, the world is advocating that pregnant women should get vaccinated against COVID-19. Yes, I know there's a big movement of the anti-vaxxers and the anti-vaxxers. And I'm like, it's until you manage a woman. I've just discharged one patient, 23 weeks, can hardly breathe. Her oxygen saturations were going down to 75 on room air. We had to be putting her on oxygen supplementation. And this woman, if we didn't take drastic action, may actually have lost her life, may have lost the baby. And we have lost, it's sad to say, we've lost our colleagues, we've lost our patients because they're pregnant and they have COVID-19 pneumonia. We have people who are going to have long-term complications because of COVID-19 pneumonia in pregnancy.
Right.
So it's just, it came up, so I think it's something that we should discuss.
Yeah.
So it is being advocated that all women, regardless of gestation, should get vaccinated. And I'm going to use this opportunity to really encourage people to get vaccinated.
Right.
Sorry for taking a bit long, but it's what is going to be affecting us. We thank God that the lockdown has been lifted, but with that, we're going to get another wave, and you can take that to the bank. And what people have to realize is that every subsequent wave of coronavirus has been worse than the first. In the first wave, very few pregnant women were getting affected because they belonged to a group. Most pregnant women are young and healthy, and coronavirus was not affecting the very young and healthy people as much. Yes, they were getting affected, but very few people. And the ones who were getting affected, you'd find they most probably had some other underlying disease that was making them susceptible to coronavirus. The last strain, Delta, I tell people, came for the pregnant women. Delta strain came for the pregnant women. So if somebody was not very fast to switch how they're managing, in the first wave, the pregnant women, they came, they were 38 weeks, 37 weeks, 36 weeks, 28 weeks. They have corona, you diagnose, they're not symptomatic, you just keep them because we don't know what was happening. You observe, they go home, they come back and deliver, they're in labor, we deliver them, they go home, they were not having problems.
Yeah.
Delta strain, and believe you, one of my colleagues lost his wife. His wife is a doctor. She's dead and buried because of coronavirus. So my advice to, and not just pregnant women, anyone who is listening, kindly get vaccinated for COVID-19 pneumonia.
Okay. Well said.
So the other vaccine would be the flu shot. So a lot of people have implemented that they're also giving the flu shot. Here, not so much, but definitely we're going to give a tetanus toxoid vaccine in pregnancy.
And by the way, during my introduction, did I, define second trimester well, or what are some of the symptoms? I don't want to
you are a lay person, so you're going to use months, and we don't have a problem. And you've used the 13. We love dealing in weeks because our management depends on the number of weeks of gestation a patient is. So case in point, bleeding. Bleeding at any point in the pregnancy, you're bleeding at 8 weeks, the management is different. You're bleeding at 12 weeks, the management is different. You're bleeding at 28 weeks, the management is different. So for us, it's very important to define the weeks because it will make the difference of, do I need to give steroids? Do I need to help lung maturity? And 1 week can make a very big difference, especially in a severely preterm instance, especially the second trimester. Like now, if my patient hadn't recovered at 23 weeks from the COVID-19 pneumonia, we were going to think, are we delivering this mother? Now, when you're delivering somebody at 23 weeks, is that a delivery? Is it a termination? And those were some of the conversations we're going to have. So back to more fun stuff. So I love second trimester. Second trimester is so awesome because you know you're pregnant, but you don't feel pregnant. Your nausea has gone, vomiting has gone, breast tenderness has gone, you're well. As you said, the bump is just beginning to show. And this is when you start perceiving the first movements. So people are like, I'm waiting for a kick. I'm like, no, your first movements cannot be a kick. Your first movements will be some slight thing. And I think I'm going to write a book one day, and definitely there'll be a chapter on women's perception of their first fetal movements. I've been made to laugh in my consultation room because somebody will tell you, oh, they feel like worms are crossing across. It's just your first feeling, perception of when you first notice, because some people feel like it's gas. It's ever so slight. So your first movement is never going to be a kick. And why isn't it going to be a kick? Because one, the fetus itself is so small and it's surrounded by so much amniotic fluid. So you find it's just like a slight vibration, slight pulsation. So the most common is somebody feels like there's a heartbeat, but in the stomach, flutter. So all sorts of things have been told. Worms, they thought alikuwa na minyoo, even maybe they went to deworm themselves because they feel like something strange is happening here. So it's been very interesting how women, so the point is that different women, their perception is very different. So you can imagine a butterfly, minyoo, gas, heartbeat, those, they don't sound the same, yet that's how they describe their movements. For a first-time mom, we normally expect these movements to start between the 16th and 20th week of pregnancy. For a mother who's had a previous pregnancy, they can, I think the earliest someone has ever told me the experience is about 12 weeks. However, on average, it should be from about 14 weeks onwards. It's not cast in stone that at 16 weeks you must hear the movement. As long as by the 20th week you start perceiving the fetal movements, that would be normal. Anecdotally, we've had these patients who come to labor ward, term pregnancy, and they don't know they were pregnant. And the baby is term. And you're like, you didn't feel movement? So she says, I just thought it was gas. Or something like that. So because as the baby grows, those slight movements are going to become obvious kicks. But I think there's even a whole show on one of these channels dedicated to, I didn't know I was pregnant. And the type of stories we hear, you're like, seriously? But that was their experience. I don't think anybody would go out of their way to really concoct such a story. And I have actually experienced a woman. She was on a birth control method, conceived on the method, didn't know, and came to the labor ward in labor and knew for the first time in labor that she was pregnant. So,
so how important are antenatal visits during the second trimester? What does this mean to the mother and the baby, because the baby is developing at this stage? So again, as we said, prevention always better than cure. And even if we have to cure, the earlier you diagnose something, the earlier you start the correct treatment, the better the prognosis for that particular disease. So it's just same things. It would be to look at our tests, the ones I've mentioned, how are they? So if somebody is, say, blood group O negative, now that's a rhesus negative person, there's some things we need to do to help the pregnancy, but normally the benefit would be for subsequent pregnancies, because if the mother gets iso-immunized, she's likely to lose her subsequent pregnancies. And we definitely do not want that type of situation to occur. Somebody is, say, diagnosed with, say, HIV or syphilis or even hepatitis. All our interventions are going to be based on trying to prevent the baby from getting those diseases during the course of the pregnancy and during delivery and breastfeeding. Somebody has, say, low hemoglobin levels. The low hemoglobin levels are not good because we know at the point when the mother is going to deliver, she's going to lose blood. And sometimes if somebody's blood levels are not adequate, even very minute blood loss can cause them to have cardiac failure. And we don't want that. We want the mother to have a healthy pregnancy, have a safe delivery, and go home at the end of that. And we know that the big killers of mothers would be bleeding, would be high blood pressure. Simple. Taking a blood pressure, you walk into any pharmacist, they're going to be able to take a blood pressure. So it's a simple, I'll just call it test for the time of
being, and you can yield a lot of information that's going to help you intervene in a timely manner and be able to treat this woman. We have noticed that you find that women managed, the higher the level of care, they tend to get less severe outcomes and don't get severe complications. But the only reason is that it's picked up very early issues, they are managed very early, and interventions are done in a timely manner. I'm not saying that all people don't get complications, but you're able to pick these complications quickly, deal with them, and for the most part, you're going to have a good outcome.
Yeah.
A lot of the women who die because of pregnancy and childbirth is because either something was not recognized in a timely manner, it was not recognized in a timely manner, interventions are not instituted in a timely manner, and therefore the outcome is going to be poor. So this is also a time when we start teaching the woman what are danger signs in pregnancy, what is her birth plan, because we want all women to deliver in a healthcare facility or at least under the care of a healthcare provider.
Right.
Okay.
Maybe we can talk about the danger signs, because you said most of the symptoms disappear when a woman gets into the second trimester. But what is normal, what is not normal?
Okay.
Yeah.
So again, we've talked about our danger signs. So I think a danger sign which everybody will know whether I tell them or not would be bleeding.
Right.
We all know it's not normal to bleed when you're pregnant. So other danger signs would be that if her water breaks, so that is what we call a premature rupture of the membranes, that is not good because of two reasons. One, very high risk of infection and high probability of delivering the baby before the due date. Preterm babies have a lot of complications. We always want to deliver a baby at term rather than premature. Another danger sign would be, as we said, we checked the high blood pressure. High blood pressure would manifest itself with headache, along even anemia, that is the low blood levels. So if somebody looks and their hands are white, I don't know if you check your teeth, your tongue when you're brushing and it appears to be white. I know we're not checking our eyelids. We'd clinically check the mucosal surfaces of the eye to see if the woman's blood levels are low. But some of the manifestations would be that she gets headaches easily, she gets dizzy, or she gets like her heart feels like it's racing, what we call palpitations. So that those could be other danger signs. And the worst danger sign would be convulsions. Convulsions in somebody who's not known to have epileptic disease previously or any convulsive disorder previously. So any pregnant woman who has a convulsion during the course of the pregnancy has eclampsia. Now remember, we talked about the probability of high blood pressure, preeclampsia. The worst and most severe form of that high blood pressure is eclampsia. So that means the blood pressure is too high. She's having issues in the brain, she's having issues in the kidney, and because of the issues in the brain, that's why she's convulsing. So any woman who convulses, we're going to say it is eclampsia until we can prove otherwise. There are other reasons why people can convulse, but until we can prove that there's another cause for those convulsions, it's eclampsia. And as I've said, those are the big killers of women. Big killers of women would always be hypertension, infection, bleeding, and obstructed labor. So that we'll probably talk about when we're talking about labor and delivery.
And talking about the danger signs and the red flags during pregnancy, maybe how best should a woman take care of themselves and the baby? Because here we are seeing a baby bump, the sleeping posture. How best should they, what are some of the things that they should be doing during this time?
Okay, so as I've said, it's just attending the clinics, a balanced diet, a lot of vegetables, fruits. You still need your protein and carbohydrate or starch source. Hydrate well. Clinics, when you come to the clinics, whether it's the midwife or the doctor or any other healthcare professional, it's now their duty to do due diligence and make sure that what needs to be checked has been checked and any abnormal finding has been addressed. You do that, we're most probably going to have a normal course of pregnancy. Lifestyle, we're still going to maintain, other than the healthy diet, the hydration, exercise, and we've said, now, if you find a mother for the first time, and maybe she has not been doing a lot of exercise, we don't advocate like now start swimming or start doing taekwondo. We don't want something like that. But as I said, a simple 30-minute brisk walk daily basis is good enough in terms of exercise. So for me, as I said, I love the second trimester.
You love the second trimester. There's a lot of
you're pregnant, but you don't feel pregnant.
But you don't feel pregnant. And there's a lot of excitement. And the woman may even ask you as an expert, how does my baby look like? Are you able to tell?
Okay, as I've said, with the advent of ultrasound, we have 3D, even 4D ultrasound, and we're actually able to recreate an image to actually show you how your baby actually looks like. They're quite expensive, so it's in a few facilities, but we're actually able to produce for you a picture and show you what your baby actually looks like in the womb. But even with the 2D, it's so exciting. You see the baby and they're so active, they'll just be playing in there on the screen, and you'll be able to see, and you'll get some places actually give you the video of the ultrasound, or you'll be given some still pictures of the ultrasound.
And at this time, maybe, is this the stage where you tend to identify the sex of your baby?
Okay, now that's again a very interesting thing. Fortunately, in this country, yes, we may like boys, but I don't think there's anyone who will particularly want to get rid of a pregnancy because it is of a female gender. So yes, this is a good time. The best time to normally check for the gender would be between about, say, 24 weeks of pregnancy, and we're actually able to tell what the gender is on ultrasound. And so it's ultrasound has really helped the modern day obstetrician, and especially for those who are practicing what we call maternal fetal medicine. So these are the experts who really deal with, let's just say you have thyroid disease in pregnancy, or you have a history of babies who have congenital abnormalities. The way they scan, they're able to give you such amazing information, and that is able to help you and the baby for the pregnancy. Thank
you so much. I'm sure we'll be talking about complications, neonatal complications, when we'll be talking about the third trimester of a pregnancy. But for now, thank you for this informative conversation that you've agreed to be part of this evening. Okay. That's all the time we had for your health show this evening. Thank you for watching. I'm Purity Museo. You can always be part of our conversation by using our social media platforms, Twitter, Facebook, KBC Channel 1 News, Purity_Museo. I'll see you again next week. Same place, same time, God willing. Stay safe.